8. Okay, so we have a quorum. So I'm going to call the Senior Services Grant Commission to order at 10:34. Can we have a roll call, please?
Yes. Alta.
Here.
Campbell.
Here.
Goldman. Hart.
Here.
Hill.
Here.
Holtz.
Here.
Krieger.
Here.
Miller.
Am I the only Miller?
You're unique at this group.
Well, as I was going through the old minutes, I'm like, oh, Millers have come and gone, so I didn't know if I was the only Miller. Thank you.
Nicholas. Fletz. Ruth. Thomas.
Here.
All right.
Okay, again, can I have a motion to allow Carrie Holtz to participate electronically? Ms. Hill, seconded by Mr. Thomas. All those in favor say aye.
Aye.
Okay, welcome, Carrie.
Thank you.
Before we review the minutes too, I'm going to note that we are going to change the agenda order a little bit, not terribly, because Ms. Miller has to leave here by 11, and I want to make sure that I have a quorum for those action items. So we will move some things around. For example, the election of a vice chair to the committee, which is done by you, the commission members, and then also the age determination. Those are the two major issues we need to take action on today.
Madam Chair, I'm good till about 11:07 with the roads being in good condition.
Okay.
If that helps-
We're
if that
still
helps
going to
you.
roll, Susan.
If
We're
that
going to
helps
roll.
you.
Again, I tried to make everybody introduce themselves as we went around. Is there anyone who did not meet everyone here at the commission? Drew is new member. He represents the Department of Transportation, so he is the successor to Mr. Henning. Will be bringing us the same type of information, and Scott has promised me verbally as well as in writing that he will ensure that Drew gets the historical perspective and has all the information. So, thank you, welcome. Really appreciate it. Everybody knows Eric from Community Development. And this is Sarah's first meeting too. Sarah was hired 94 days ago to replace Bianca. So we've got a lot of new staff people. I am sure their perspective will give us great opportunity. It's always nice to have new people join us.
I apologize for missing Drew on the attendance. I forgot to call.
Oh,
It
did
wasn't
you?
on my list.
Okay. Drew, are you here?
I am here.
He's here. Okay. Okay, so can I have a motion to approve the minutes as presented?
So moved.
Thank you. Seconded by Ms. Hill. All those in favor say aye.
Aye.
Anyone opposed?
I'm going to abstain since I'm new.
Okay.
Thank you.
There is no one signed in for public comment. Looking in the audience, anyone have anything to say? We'll move on. New business. Let's talk about the election of a vice chair. In the event, and I can tell you right now, I do know that there will be one meeting that I will not be here for. In fact, I think it's the next meeting. I'll be in Hawaii at a wedding.
Oh.
At a wedding. The vice chair typically is not another elected official. Typically, it's somebody from the other side of the table, not-for-profit, or one of the meetings at large. It doesn't have to be that way. I'm just giving you a historical. So anyone want to volunteer to be nominated to be the vice chair of the commission? I mean, I'll look at Ms. Hill. I mean, you've been the county chairperson and you've served on this commission. Would that be something that you would consider doing?
Sure.
Okay, anyone else want to volunteer?
And if you do, it's yours.
In that event, can I have a motion to appoint Ms. Hill as the vice chair of the commission? Ms. Campbell, seconded by Mr. Thomas. All those in favor say aye.
Aye.
Excellent, thank you. Welcome.
Yes.
Yay. Make sure you get her phone number before she leaves. And then the next item we need to really talk about is this age determination. A little historical. Every organization kind of sort of looked at a senior in a different light. That came to head, and when did you say, Sue? 2000 and...
March of 2014.
We had a conversation, but no action was taken. So every organization, and they evaluate how many seniors they are serving based on age, and then a quarter of an hour as one unit. So we were getting information and it wasn't comparable. I couldn't tell you how many seniors we were serving because it varied. So at the last meeting, we made a determination to go back to our state's attorney as well as the Community Development Department and ask them to come up with some recommendations. Well, talking to the state's attorney, as you just heard me say a little earlier, seniors go from 55 to 65 to 67, depending upon what program, statutorily. That's true for the state of Illinois as well as at the federal level. So there's no real guidance for us from that perspective. In talking to Adam Wallen, we only have $2 million, and I say only, which is an increase from prior years of 1.6. I am personally, and conversation open, but I am personally committed to creating something that allows us to provide the most amount of services to the most vulnerable. So my recommendation would be is we create the age 60, which is pretty average from what most of our organizations are telling us, unless there is some type of exception that we should consider. And I would tell people if there is, they need to put that in their application and then justify why it's an exception. For example, Pioneer. Their seniors might be significantly less in age, right? Maybe 55, whatever. If they can justify that and this commission decides that that is something that they feel comfortable in funding at that age level, then we'll do that. But it's in the contract, and that's why we need to make a decision now. So in the contract, it says, whoever gets the money, you're serving people at age 60 or whatever that exception is. And then they are required to provide us that data and that data alone. So that would be my recommendation. Adam is comfortable with that. The state's attorney's office told me that whatever we decided, their job to defend whatever we decided. So having explained all of that, open it up for conversation. Anybody have a comment, opinion, guidance? Mr. Thomas.
So if it started at, you're picking 55 to 65, you're picking 60 as the general.
It's 55 to 67.
Or 67.
But yeah.
Is there, so that's a start, is there an end?
No,
So you
anybody
can be
who's
85
above,
and be able
yeah,
to
right,
take care of these, okay.
right. It's the threshold, the floor. It's the floor,
It's the
not the
floor.
ceiling, yeah.
That'll be 60, or whatever we determine.
Yeah.
Okay.
And it's just, again, more for reporting requirements so that we have a uniform decision as to what that is. And this will become then part of the commission's policy. Ms.
I'm
Miller?
very comfortable with 60. In preparation for the meeting, I did a boatload of what is a senior and literally put it in Copilot and say, what is a senior? And you get responses from like AARP that is 50, and then commercial retail starts at 55, and then government, depending on the.
Well, you don't get a tax exemption until you're 65, but you also are applicable for additional state funds when you're 62. So,
Exactly.
you know, I mean.
So 62, 65, 67,
Right.
70, when are you entitled to things? So 60 seems to be a number that could resonate with just about everyone, as long as we have that exemption in there. And we may want to talk about the disability exemption as well, that if we have a 50-year-old that is seeking services through one of our partners and they are disabled, that should also be something we're aware of for exceptions, because that person is unique to the system.
And I would agree. I think that's the whole idea I was trying to get at too. And as long as that's reported to us as part of the data, I have no problem with that. But again, we somehow have to have reporting requirements of how we're spending our money and who's getting those services. And I just wanted it to be consistent across all organizations.
So can we put that in the language that it's 60 and case-by-case exceptions as presented?
We would let them know, I think, upfront. They would have to indicate to us as part of their application that there may be some exemptions, and they can identify those exemptions.
So that would be written in the contract?
It is written, it'll be an addendum to the contract.
Okay.
So, because again, if there are exceptions or exemptions, that will be included in the addendum for those organizations.
Well, and it's really talking about the recipients of the opportunities. So if they have a demographic that serves a particular group, that would meet the exception or create it. You know, we don't know what those exceptions are in this world.
Correct.
Yeah, I would be very comfortable with that. But I think for documentation, and it'll be in the minutes that we're talking about exceptions and creating opportunity for less than 60 on a case by case, I think that's important.
Hands down. That was the whole point, but again, in general, our cutoff is 60.
So move.
Wait. I just wanted to add, in speaking with
Please.
Adam, we were suggesting 60 as well, for a number of reasons. 55, we thought might create some capacity issues with the non-for-profits. Now, all of us, like if most nonprofits are 60 anyway, so if we're going to 55, could that create a capacity issue where it's like, well, now we need more staff because we're serving so many more people. The other consideration was 65 could mean that people who are currently 60, 61, 60, not quite 65, but getting a ride to dialysis are now going to have to be told, I'm sorry, but come back in 3 years when you're eligible. So that's kind of the basis for the reasoning that we're suggesting that.
Ms. Hart?
I too was in agreement with 60 as I read materials this week. And thinking of 55, maybe I'm just too skeptical, but AARP is a group that needs a large pool.
Membership-driven. Membership-driven.
To get their members to participate. So of course it's to their advantage to be at 55 or 50. I think we're thinking about, we're going to be paying organizations to help people. We look at it slightly different.
And it'll make it easier for them too,
Yes.
right? To know how much money they need to provide those services to their group of people, Mr. Thomas.
For the past 21 years, what was the floor to start?
You know what, I can't answer that because some organizations did 55, some did 60, there was none. It was what they gave us, and that was one of the questions, that's how this all came up, is in the presentations, that was my question. What's your senior definition? Well, you know, depending upon what services we're providing, which is, again, fine, but it's inconsistent for us across the board on determining how that money is being utilized. So, and 60 was kind of what most of them, the average kind of what most organizations were using.
Okay, I just didn't know if we did go to 60, how many folks would be left out?
I'm hoping not too many, and again, we'll find out through the application process, right?
So has there been a capture of total demographics in this population, meaning how many people capture 55, how many people capture 60?
I don't think we've done that internally.
Okay, I'm just wondering if there's a higher population, you know, from the, depending on, you know, age groups, how they vary, and if
When we have, that's again, I love that, and maybe when we have some extra time and bodies, maybe an intern could do that with some of the information that we
That would
have
just be
available.
interesting, right?
Yeah.
how many people are in this bracket, how many people are in this bracket, so we would have a better conception
Yeah.
of where's the need
Who's
and
being left
quantity.
out or-
Right.
I think
Right.
another way we could tackle that is, you know, rather than just saying, here's the whole population and who could be left out, have some sort of reporting requirement of who didn't meet the threshold, you know, who is 59 and requesting the service. And then they report that
That's
to
a
us,
good
so we
idea,
can
too.
change the
Okay.
need as time goes on. We can
A
consider
method.
revising the number.
Yeah.
if
That's a
needed.
really good idea. Maybe we can do that in the application too. Not a requirement, but right now we'll do it voluntarily.
Sure.
Because I don't want to place a huge, I don't know if anybody understands, but, you know, administering a grant takes a huge amount of time, you know, to submit for reimbursement. I don't want to burden my not-for-profits who are already shrinking in staff and money any further than I have to. So maybe we can start it on a volunteer basis.
Sure.
And then, then do a requirement, but I like the idea. I really do. Yeah. Ms. Hill?
I knew
And
there
Ms.
was
Campbell?
demographics somewhere, and this is just a general idea. According to our American Community Survey, 29,666 people in McHenry County are between the ages of 65 and 74. In 2021, more than a third of McHenry County's population was 50 or over.
It increases every year because people do not leave, which is, again, wonderful.
And we're all getting older.
So, Ms. Hill, was that a motion to adopt this as a policy?
for age 60.
And I'm gonna work with the state's attorney's office and Sarah to make sure that we write that appropriately in the minutes so that we're covering all of our bases. Do I have a second, Ms. Miller? All right, and can I have a roll call? Because it's
Yes.
obviously a policy.
Alta,
Yes.
Campbell,
Yes.
Hart,
Yes.
Hill,
Yes.
Krieger,
Yes.
Miller,
Yes.
Thomas,
Yes.
Duffin.
Yes.
Did you
And just
get
real
the
quickly,
online?
huh? What?
Online person.
Oh, I'm sorry.
Carrie?
Holtz,
Yes.
Thank you. And just real quickly, we talked about it, we've moved the Friday, September 12th meeting to September 19th to accommodate a lot of people who, from our not-for-profit representation, are otherwise engaged on that day. We'd lose too many people to have a quorum. So I apologize in advance, just was unaware. Thank you, Abby, for bringing that to my attention. So we'll make it on the 19th. That is the all-day meeting, so make sure you're available. We provide lunch. Okay. Going back now to old business, ElderWorks. I'm smiling. Let me give you a little bit. Diane, you want to come up? Or Deanna, sorry, I did it again. Let me give you guys a little bit of background. I've said it numerous times, but in many years past, there was not a scoring process. A lot of the decision-making was done very subjectively. And at one of our meetings, at a tail end, a motion was amended to add taking ElderWorks out of the presentation process. I will throw myself on the grenade and look at all of you and tell you, and Ian knows that I apologize. It caught me completely off guard and it went through. And afterwards, I realized that that was inappropriate. So what we decided to do is, after we received a letter of request, ElderWorks is here today to explain to all of you what they do and how they provide services to seniors, so that we allow them to come back and be an applicant, because they were removed from that availability. So, because it was the opinion of several people that it wasn't appropriate. So, floor is yours. That's kind of the background. And I feel pretty strongly that we owe you the opportunity to make that presentation. So,
First off, I'm humbled to be in front of you guys today. I'm a lifelong McHenry County citizen. I've lived in McHenry County my whole life. Grew up in Johnsburg on a family farm. Came and worked here in Woodstock, lived here in Woodstock because I worked at the hospital for years on nights. Moved and bought my grandparents' house in Johnsburg. I'm a Johnsburg girl. I've been with ElderWorks for just over 3.5 years. I've been in healthcare since I graduated high school with my CNA at 17. To Pam's point, and some of that I've heard at this meeting so far this morning, this grant commission has changed in leaps and bounds in uniting the county. ElderWorks is a non-for-profit 501c3 organization. We were formed in 2012. And our mission is really to make sure we're serving all seniors. Now, we were founded in McHenry County. 1/3 of everything we do is in McHenry County, but we also help throughout the state. If you want, I can send Sarah a PowerPoint that has some numbers and some figures for it. But I figured it would be a little bit more humble to just have a dialogue with you all. And it fits more with what we do. To address why we were potentially taken out of the application process. That wasn't something new for ElderWorks. We have been removed in the past because people saw us as a duplicative process within McHenry County with other organizations. I'm here to tell you that McHenry County is one of the exceeding counties in the state of Illinois in how they support their seniors. And I will say that whether ElderWorks moves forward with funding or not in the application process, because this county believes in their seniors. And I 100% will say that. One of the graphs that I will share within the PowerPoint is a PowerPoint slide that has all of the organizations that ElderWorks partners with. And when I talk about partnering, it's everything from the VAC here in McHenry County, which, if you all didn't know, is one of the strongest VACs in the state, and it is an incredible resource. We're partnering with them to offer 6 series of education to help our veterans and their families access better education. The connections that Pam referenced of all these different organizations, Independence Health and Therapy, Senior Services Associates, we all work collaboratively. We don't work competitively. And I think that was a misunderstanding. We all help each other. Senior Services Associates, as an example, this directory that ElderWorks puts out every 2 years. This is the old one. The new one came from the printer and it wasn't bound correctly. I was supposed to have it for you guys today. It went back to the printer. We'll get it. We put this out every 2 years. We have to fundraise for this. This used to cost us $40,000. It cost us over $80,000 to put out every 2 years. I will tell you that over 250 of these went through the organization of Senior Services Associates that they gave to their senior clientele. Senior Care Volunteer Network uses it as well. I believe when I was talking with Sarah from there, they counted that they had done 50 through cases, and then she went back and she goes, no, I think that was our second batch. So we collaboratively work. What is ElderWorks? We're here for our seniors, to help them with case management, to help them find their resources and navigate. When you're looking at a senior, which we have established today at this meeting is 60 and older, I will tell you there are seniors that have planned well, and there are seniors that haven't, and they can't figure out how to navigate. Whether we're trying to get them in connection with the housing authority because, golly gee, I can't, with my taxes and what I have in my home, I can't stay here anymore. Our goal is always to keep our senior in their home, but they can't when they don't have the funds to be able to do that. Working with Prairie State Legal to help them because of advanced directives, or they're solo seniors and they don't have things to age. We help them navigate all of that, and I can't tell you how many hours we spend on the phone trying to help these seniors navigate. The aging counseling is key. McHenry County Senior Service, or McHenry County Sheriff's Department, you now have social workers that are in all of the police and EMS forces. They call us on a regular basis of, hey, we need to brainstorm, we need to figure this out. How can we do this? We've already reached out to this organization, and I'm like, hey, I've got a better connection. Let's just call that person, we'll help them navigate. So there is a lot that ElderWorks does, from engaging volunteers that help with isolation to virtual education, so we can actually reach seniors in their home and they feel connected. Something as simple as having a cup of coffee with friends that they don't do anymore. The pandemic has not been kind, right? And a lot of seniors are afraid to even go out anymore. And so trying to connect them. That's all about the connectivity for the seniors. We do so much more. It's helping them find the funding. How do I pay for this, and who can I go to? We have literally in 2019, we had, off the top of my head, I'm going to say about 200 seniors that reached out to us, low income. Already in the month of January, we had 225 seniors that have reached out last year. And demographics are key, and I will say this to you, when you do an application, anybody, a not-for-profit that's reporting numbers to you, they can only report within that grant, right? So when I report on a grant, I will only do whatever that baseline is, 60 and older. But if we're helping somebody that is, and I will say we've had a growing population from 53 to 57 reaching out recently, we count them if we can in our system, but we cannot report on them because they don't meet
Or use any of our grant funds for that
Correct.
program.
We cannot touch any of that. So there shouldn't be a concern on that, but the numbers are growing. And the cap I have for you right now is I have a 98-year-old woman that we're assisting who actually is part of our Stepping Out to Fitness program. And she volunteers and she's making walker bags. And she's doing these things because she's paying it forward. And that's what she believes. But I have a 64-year-old husband who's caring for his 72-year-old wife, and she has dementia. And it's become a physical piece in the home where we're working with the social worker from the police stations to be able to navigate and get the resources and get her into day programming and Independence Health and Therapy so he can have some downtime and helping him navigate this. They want to stay at home. And I don't think it's an unfair statement that whether NAMI, Catholic Charities, Thresholds, Home of the Sparrow, Catholic Charities, Senior Services, Senior Care Volunteer Network, Independence Health and Therapy, any of the ones I've mentioned, and I have 22 of them on this piece of paper in front of me, not one of us can do it by ourselves. And that's why McHenry County is the best place to age, because there are all of these resources, and collaboratively we make it a better place.
Thank you. And I'm going to do this. Can I have a motion to repeal the previous decision by the commission and allow ElderWorks to again be able to apply, be an applicant for our senior services grant dollars?
So moved.
Can I have a second? Thank you. I'm going to open the roll, just Sue, so you have asked questions. We'll continue the conversation, but if you have to leave, then you can place your vote before you walk off the door, and that's our last action item for today, okay? Anyone have any questions? Comments?
Well, I would comment,
Please.
obviously being in the role that I've been in, many roles that I'm in, I work and refer many clients to ElderWorks and have been very pleased with their problem-solving approach to assistance. So thank you for all that you do. Because there are so many things out there and no one aggregates it as well as you do. So from personal experience, there is no reason not to assist you because you're assisting others that have an inability to seek assistance on their own. So I think you do what the greater good does of assemble it and put the right spots together. So thank you.
Yeah. Any other questions and or comments, Mr. Thomas?
Is there anybody else or any other applicants doing what you said that?
Sure, there are. Senior services, senior care, and I think that was the misinterpretation, maybe. And you stated a little earlier, we have many organizations that do similar services. I don't know if I'd say they're duplicative, but our seniors are located in different areas in the county, and each of them have their favorites of who they choose to go to or what the comfort level is. And to exclude one because the assumption was made that they're doing the same exact thing, I don't think so. It's a different population of people. But so, yeah, and go ahead.
Can I answer?
Yeah, please.
So one of the things, when you look at different organizations, they all have their own guidelines. And when it comes to federal dollars, where we traditionally don't have federal dollars, there are specific things that they can help with. they have to be at 30-50% at the average mean income. There are different, I'm using that as an example, right? So you end up with a bunch of seniors right now where, and this will sort of put it more towards Senior Care Volunteer Network and us,
Right.
where if they are under a certain amount of income, they can get the Community Cares Program, which is part of IDOA, which is part of the Council on Aging throughout the federal government. They can get some care, right? But if they're too much, but don't have enough that they can't pay for a caregiver themselves, then it's like you've got to get creative. And how can they do that? The volunteers that do the friendly visits through Senior Care Volunteer Network, using different church groups and helping people find alternatives when that money can't work is one of those things I think you were referencing as trying to help them find that niche. And I think that Elder Works in the past has been looked upon as we do like senior services associates, and we work hand in hand with them. They present for us, we present for them, we pass cases back and forth to help that we were competing with them. This isn't a competition, it's a collaboration.
Yeah.
Is that a word?
Yeah, perfect.
You had mentioned about a third of your work would be done in McHenry County if you were going to come back as an applicant.
I love you. It was one of the things that both Sarah and I really did. Our funds given to those various organizations for those various programs must serve only McHenry County residents. That's part of our
So-
requirement as well.
So when I do,
The money can't get convoluted to other counties or whatever the third or whatever.
That's the point of the documentation and adding the addendum for the age, et cetera, because there are reporting requirements. Sue, do you want to cast your vote before you leave? On
Yes.
the motion? Yes?
Yes.
Okay, thank you.
Thank you.
Ms. Harper?
Thanks, Dan.
I'm thinking back to the discussions previous groups have had about the duplication of services, and I think that that's true. That there just wasn't a deep enough understanding on the part of the commission as to perhaps the differences in populations between your group and others that you work with, or how you work with someone and you might be responsible for this part of their care and another group is responsible for another part of the care. So I'm thinking next September when you're presenting, if that can be made very clear as part of your presentation,
got it.
that would help the board members.
Good point. Thank you. That's great. Any other comments, questions? All right, we open the roll. Sue has, yes, can we finish the roll call, please, Eric?
Yes. Alta,
Yes.
Campbell, Hart,
Yes.
Hill,
Yes.
Holtz,
Yes.
Krieger,
Yes.
Thomas,
Yes.
Duffin,
Yes.
Okay, motion carries.
Thank you.
Excellent.
It will be.
No, and again, my apologies. Yeah, would you please extend that to the rest of the group at Elder Works?
Thank you.
Moving on to old business. It now becomes the Sarah Show. So every meeting we go through the expenditures, where we are on the monies that we had authorized to be utilized. And so this is part of your requirement, being a commission member, is to make sure that we're doing it appropriately. So as soon as Sarah can hear this. Again, some organizations are permitted a monthly drawdown. Others, which is what we prefer, is quarterly. That allows us a little bit more latitude when we invest our funds to know how, how much we can invest, how much we can't. So we really prefer the quarterly drawdown, but there are some organizations that just financially can't make it. It's a good question to ask them too, where they get their other funds to run the programs they run. It's interesting. So Sarah, you want to go through and note?
Yeah.
Oh, Eric, I'm sorry. I apologize. Eric, Eric, you want to go through this?
Yeah, so for the 2024 grant year, there was $29,534.70 left over. The majority of these unspent funds were from two projects, the McHenry County Housing Authority Senior Dental Program and the Harvard Community Senior Center Pearls program. This morning I talked with Kim Olbrich from the Housing Authority regarding the leftover funds, and she said there were a combination of factors that led to it. The Housing Authority noticed that they had a difficult time with people returning required documents, not just seniors, but for all of their programs. So this would be stuff like income qualification documents, whatever they need for applications. They also noted that there were 3 seniors with vouchers that were planning to have significant work done with the dental program, but they all ended up facing medical issues and they could not get well enough to get into the dentist. So that heavily contributed to the unspent funds. She said that the unspent funds from 2024 were likely an anomaly, and looking back at prior year spending, that could very well be true. And she also said that they will be monitoring their 2025 spending, and if they see the same thing happening, they'd be open to sending the funds back so another program can utilize them. And then for the Harvard Community Senior Center project, the transition of executive directors, along with their bilingual coordinator being away for a few months, they said that contributed to the unspent funds. In the prior meeting, which I know a few of you weren't here for that, Linda Rohe, their executive director at the time, said they didn't feel right starting any new Pearls clients during that time because of the nature of the program and the relationships between the clients and the coordinators. So that's how the 2024 funds ended up.
Okay. And it was a conversation that we had also had kind of preliminarily before the meeting, is we will also reach out to our other senior organizations and see if we can't help coordinate maybe some assistance in filling out those forms for the program. And my big news for those of you who were here, Peg, I'm talking to you, Tina, I'm talking to you. If you'll remember, we had an organization present to us last year that we basically learned it was a first time and we didn't have any history, and it was again for dental care. We discovered subsequently that that was the biggest scam that was going on in the suburban area, and 2 counties literally gave them funds. So, ready? Bless our little hearts. So again, we did well in questioning and really kind of deciding that that was an inappropriate use of our money.
Well, that was the most poorly presentation too.
Well, that's why, because
it wasn't real.
Right, because it wasn't real. They didn't have, so again, the new people, I look at you, scams, right here, local government, all the time. So I just thought that that was extraordinarily interesting that we heard from other counties who had lost that money. And we were kind of proud that we said, no way. So anyway, and it was, again, it was a program for dental care. And a lot of what happens with dental care is as people age, instead of getting individual cares or implants, they ultimately, the cheaper way to go is dentures. So we look at that too. I don't know if that's necessarily the best health decision, but it certainly is a financial decision. And so there's some discussion about that too, where we go with that. Anybody have any questions about the expenditures? The anomalies are not unusual. We have had situations where people just were unable to spend down. Sometimes it's paralegal, and sometimes we have situations where people spend and need more assistance. So
I missed, sorry I walked out. Does that mean that 29,000 will be spread out to some other agencies?
it just comes back to us. Typically, we just put it back into the.
It's gonna be in our pile.
Yeah.
Okay.
Yeah, so next year we'll have a little bit more money to spend unless, again, the
Yeah, roll it
commissions.
over.
Yeah, absolutely,
Okay.
yeah. Unless we decide to put that, again, in a reserve fund, which I would recommend. We'd be very cautious with too much money in a reserve fund. Our job is to spend the money on our seniors, not to save money. So, okay. Next item on the agenda is the Q1 update. Is that still you, Eric?
Yes.
All right.
I'm sorry. Go back to that. If we bring in elder care, what does that do to their budgets that we?
It's a whole new cycle. Every year is a
Okay,
new
so
cycle.
Not these
Right,
folks
so
may not be
no,
on
we're,
this.
yep, this is the end of the year. They spent what
Okay.
they spent. That 29 is gonna come back to us and we'll include it in next year's available funds.
Well, I mean, if we add them to this Excel file,
Don't know. You know,
Everyone's got to do a cut.
oh, I should tell you. So again, I kind of created a policy, and you guys can change anything you want. But in the past, everybody, the kind of the flavor of the day was to try and give every organization a little bit of money. I am a big no to that. I'm a hard no to that, in fact, so you'll argue with me. I just think it's ridiculous if everybody's asking for $1 and we give you a dime and you a dime and you a dime. Nobody's going to be, you can't provide the service, right, with a dime. So we kind of instituted 2 years ago to look at that list now that we're scoring and try to fund at least close to 100% of the top organizations so that they have the money for the programs that they need. Typically, we weren't funding prior to that, we weren't funding anybody at 100%. We weren't even funding people to 80%. So that's kind of the direction I'd like to continue to go in, is to try and provide to that question, to try and provide the organizations that are providing those services to our seniors as much money as we possibly can.
So all of the funding is for service, not administrative pay?
Well, some is administrative pay because you can't run a program without the administrator, right?
Correct.
Right.
So are we able to see that, that allotment?
You will see it, you will see the breakdown, and you can ask when they're in front of you. You can go deep down,
Okay.
detailed,
What percentage is going to, okay.
and you can ask why,
Uh-huh.
right? I mean, yeah. So, and that's the whole point of having a presentation, is so you can
Right.
get the answers from
Right.
them,
Okay.
rather than my interpretation or Sarah's.
One thing to keep in mind too is some of these organizations rely very heavily on volunteers, but it still has an administrative staff to oversee that.
And I'm not negating
Yeah.
it, I think there's merit to it, right, but I wanna make sure that it's a balance, right, that we're not fluffing an administrative heavily, and then not really providing service.
And the answer to the question is yes, all of that data will be available on the applications, and then even more so, when they appear before you, you ask away.
Great.
And we encourage you to dig deep. You know, it's taxpayer dollars.
Right.
So,
Right.
yeah.
And it's service for seniors.
Right. Okay, any other
Sorry for
questions?
that.
Yeah.
Nope, that's okay. Quarter one, please.
Yes, for
Thanks, Eric.
2025, the majority of agencies are going to be submitting quarterly reimbursements, and quarter one reimbursements are due March 31st, so we don't have much to report so far. To date, we've received reimbursements from Independence Health and Therapy for both their memory care and adult day health projects for January and December. That's one agency that is doing monthly reimbursements. The other one was Harvard Community Senior Center. We reached out to Noelle Tolley, the current executive director, and confirmed that they still plan on submitting monthly reimbursements, and I was told that we should receive their December and January reimbursements this upcoming Monday. So we don't really have too much to report, just those Independence Health reimbursements.
And I just want to really let you know and make you feel confident that these individuals that are responsible for this program reach out to our partners, work with them. I mean, it is a great relationship. We do not let people fall on their faces. We had a situation last year where one of our organizations that we funded for many years did not make the cutoff. And, you know, sad, but that's the way it went. But we had reached out to them. We had documentation that we had reminded them every week. So I didn't feel too badly. But that does happen, you know. But it's not on our end. We don't let the ball drop. So thank you. Questions, comments? All right. Moving on, we're out of old business. Member comments, any miscellaneous? We were going to present the plaque. You want to hold that up? Sarah will accept it because the recipient is not here to accept it herself. So Sarah will accept it on behalf of Rhonda Goldman. We will make sure it was her last day. She was the representative from the McCog group. And obviously she's not running for re-election, so she no longer can hold the position. So
is
we'll
that
present.
Sue? Is she McCog?
What?
Is Sue now the
No,
representative?
Sue is with the McHenry Housing Authority. She represents
So do
them.
we have a McCog?
We will have one that is appointed to us as soon as Rhonda officially steps down, which is after the April 1st election, or April, whatever date it is. Yeah. So yes, we will have a representative. And I'm also, a new policy is we're going to make sure that they're all from McHenry County, because we have several municipalities in McCog that cover, different counties, Lake as well as Kane. So anyway, we're making sure that they are McHenry County residents. All those little things you have to think about that you didn't think about. So we'll get this to Rhonda. If you haven't signed the card, please feel free to do so. Also, please take a donut with you, otherwise we just leave it in the lunchroom and make all the staff get fatter, or at least sugar highs. Other than that, are there any other comments, questions? Otherwise, I'll take a motion to adjourn. Ms. Campbell, seconded by